Quebec, who was vaccinated at approximately 11:30 this morning. So not only in Quebec, but today in Montreal as well, with the woman that you will meet in a few minutes. So I think that we can take this good news with us and carry it with us over the next few days and weeks. I'm announcing that in the next few days we will vaccinate, as you know, I'm sure that you've been following this for a long time, around 5,000 people in Montreal and in Quebec with the first doses that we get. And this will be done in the next few days here at the CHSLD. The Maimonides Geriatric Centre will also be vaccinating the staff from the CHSLD. And over the next few days, there will be some other employees in CHSLDs who will come here because it's a requirement from Pfizer in the beginning that we proceed in this manner, so we will respect the rules. But the good news as well is that we should be able to vaccinate over 50,000 people before the 4th of January. So it's just good news today. So I just wanted to say hello to you, and now I will hand it over. Thank you very much. And I would like to thank Minister Dubé and the health care workers who are working very hard. They've been working very hard for 9 months, perhaps even longer. This is a great day for Canada and for Quebec, for all the people of our country. However, it's the first step, I believe, because we have a lot. We have much work ahead of us. These are difficult times. We still have some difficult times ahead, and we must continue our efforts to fight against COVID-19. So I think that perhaps I'll say a few words in English as well.
It's really good news for Quebec. It's really good news for everybody across the country. But we also have to keep protecting each other. And one worry I know I would share with Minister Dubé is that Canadians think that this is just around the corner, that COVID-19 is over. This is going to help. It's a very strong tool. C'est un très fort outil. Mais nous devons protéger.
But we must protect our families, our communities.
We can do that as we wait for our turn, as we see more and more vaccines arrive chaque semaine. Merci beaucoup.
Thank you very much. And perhaps Pablo wants to say a few words? I just want to thank all of the staff in Quebec and throughout Canada, the Army, the Red Cross. It's a huge undertaking that we're beginning today. This is a historical day, but as Minister Dubé said, it's a marathon. It's a historical day. We are starting something huge today, but it's just a beginning. Let's continue together. Thank you.
Bonjour. Bonjour.
I'm sorry, the question is inaudible.
I
think it's a little bit soon. I was talking with Francine earlier. It's a bit too soon to give numbers because, firstly, everybody is very excited today. We've always said that it would be on a voluntary basis that we wanted to work with our employees. I would let a few hours go by and we'll see how things unfold. I remember that in other vaccination programs, it was never an issue. So I would just let it go for a few hours. Not for the time being. I'm repeating myself. There were already other examples where we had some high rates of participation. So let's let the next few hours go by and we'll see how things unfold. The question is inaudible. I would tell you that we're not there today. It's not an issue. I spoke with Francine earlier. Mr. Dubé said this, and I repeated this morning. Well, this is a first group that said yes, yes, yes. Those are the people who are enthusiastic. Afterwards, we will continue to vaccinate in the next few weeks. We will get more batches of vaccines. And there are some people who have said, I want to be vaccinated, but I don't want to be amongst the first. I want to see how things will go. Will there be side effects, etc.? So I think that Mr. Dubé is right. We have to wait. And there are some care settings that are more favorable than others. So when we will have more complete numbers, we will be able to make statements. Obviously, there's additional work to do in order to increase the total vaccination with the residents. It's almost 100% of them here. But give us a bit of time, and we will continue to do some work, some communication work, in order to encourage even more people to get vaccinated. Currently, as you can see, and unless I'm wrong, we've got our first vaccinated person, so it's quite recent. This afternoon, what Dr. Rosenberg told me earlier is that we should have vaccinated approximately 150 patients during the afternoon, and there are some better times, more preferable times in the afternoon to do so. In the next few days, here we're talking about around 300 patients that we have to vaccinate here. So if we do half of them this afternoon, that's huge. And then it will be the employees, like I explained earlier. It will go quite quickly, but we're ready. The good news, and I said this, we receive the vaccine and we start vaccinating. That's exactly what we're doing today. Not necessarily, because that's a good question. We had to supply a list of 20 sites last week to Pfizer to make sure that the logistics would be well tested. So 16 regions, 20 sites, it's already decided where we will be going. So we're very anxious to get the next deliveries as of the 21st of December. Yes, you are correct. When we talk about, well, you can answer, Richard. We worked with you on this. Thank you. So in the priorities, it's not only the residents, you'll meet the first person who is vaccinated, but it's also all the people who are in contact with the patients. So the priority is truly all the healthcare workers who help the patients on a day-to-day basis, not only from the Maimonides Centre, but some from other long-term care settings. So there will be an impact, not only in the center here, but in other CHSLDs as well over the next 3 to 4 days. Caretakers, that will come later. We are looking at how to define them because there's a lot of them, so we'll have to choose among the caregivers, but we would like to be able to vaccinate them as soon as possible.